Good morning, and thank you in advance for your presence here. Today we will discuss a study that we conducted on factors that may predict mortality within 6 months in hemodialysis patients. This study was carried out with the patients of the Hemodialysis Center of Korça, a city located in the southeast of Albania. The Korça Hemodialysis Center is a relatively new facility that began its operation in 2017. It is located within the premises of the Regional Hospital of Korça and serves patients from the entire Korça region. The operating of this center marked a significant improvement for hemodialysis patients who, until that time, had to travel to Elbasan or Tirana for their dialysis section. Risk factors of mortality in HD patients are very different from other populations. Classic statistical analysis has identified variables that predict mortality within these patients, and the results have been rather uniform among the different publications. In 2017, the OPP study came to the conclusion that indicators such as serum albumin, serum creatinine, hemoglobin, and neutrophilic count are independently associated with mortality. Interventions that modify these indicators of nutritional status may have important impact on the mortality of hemodialysis patients. Our study, as we said above, was conducted with patients from Korça Hemodialysis Center. The study included 118 hemodialysis patients who were over 18 years old and had been receiving regular hemodialysis sections for over 3 months. Clinical data were collected from patients' records, which include sex, age, hemodialysis durations in months, initial nephropathy, and blood pressure. We also chose to study biological parameters as albumin, serum calcium, lipid profile, hemoglobin, and C reactive protein. Subsequently, their progress was monitored for the following 6 months. Logistic regression was used to analyze the relationship between mortality within 6 months and influencing factors. The average age of the study population was 51.1 years. Out of 118 patients, 38% were females and 62% were males. After 6 months follow-up, 10 patients had passed away. Quantitative data of albumin in our study sample were as follows: minimum value 5.1 and maximum 30.8, and the mean value was 10.3 milligram per deciliter. Analyzing the variables through logistic regression, we found a statistically significant relationship between hemoglobin levels and the 6-month mortality, P equal to 0.001. Lower hemoglobin levels were associated with a higher likelihood of patient mortality within the next 6 months. Quantitative data of albumin in our study, a minimum value 2.5 milligram per deciliter and maximum 4.4 milligram per deciliter, and the mean value was 3.6. Additionally, our study revealed a statistically significant relationship between albumin levels and the 6 months mortality, P equal to 0.002. Lower albumin levels were associated with a higher likelihood of patient mortality within the next 6 months. This study confirms that indicators like hemoglobin and albumin can predict mortality among hemodialysis patients and can provide additional important prognostic information. Interventions that modify these indicators may have an important impact on the survival of hemodialysis patients. Thank you all.